Still on health, a bold pledge in President William Ruto's manifesto, dubbed as Better, was universal healthcare coverage, forming one of the major pillars for every Kenyan. 3 years on, the Social Health Authority SHA, as it is known, is at the heart of that vision, with primary healthcare as its anchor. Nearly a year later and into its rollout, the healthcare program has drawn mixed reactions. Some Kenyans hail it as a life-changing, easing medical bills and making care accessible. On the flip side, for others, the mandatory premiums remain out of reach. Tonight, we assess the Social Health Authority's promise, its wins and its stumbles. And here is Mary Mwoki.
At Ngoloni Health Center in Machakos County, mothers stream in with their children for routine clinic visits. Some do so without a worry about the bills, confident that SHA will take care of everything. Others are not so hopeful. The Primary Healthcare Act of 2023 promised free access to essential services, from immunization and maternal care to treatment of common diseases. Yet, for some like Cynthia Kavenge, the annual payment demanded upfront remains prohibitive, as majority of unsalaried Kenyans can still not afford it.
Imekuwa na changamoto mingi sana, manake you have to pay annually, na sio kila mtu mwenye ako na mapato ya kulipa kwa mwaka.
Mgonjwa akikuja hapa, hata kama labda hajajisajili ama amesajiliwa, labda anajifanya malipo yake ya kila mwezi, anapata huduma ya matibabu.
The financial challenges notwithstanding, majority however speak of relief, grateful that they no longer shoulder bills alone.
Na ilisaidia sana wakati tulimpeleka Machakos, na kwa malipo yake mimi naona iko na manufaa mazuri.
Across the country, 26 million Kenyans have registered under SHA. The Health Cabinet Secretary says usage of public health facilities has surged dramatically.
Under NHIF, only 36% of Kenyans were going to public health facilities. But as we speak today, close to 58–59% of Kenyans have shifted back.
Here in Nairobi, in Embakasi South, the Kware Dispensary, a Level 2 facility, is bustling with activity. The hospital, which is a key primary healthcare network, has seen a surge in numbers since the rollout of SHA. The hospital attributes the increase to the timely reimbursement of SHA claims and the ring fencing of the Facility Improvement Fund, which they say has kept the hospital fully operational.
We've seen the way the uptake has been in terms of the numbers. We were seeing around 250 patients, but now the number has even doubled. You can see how busy our facility is.
We were claiming for per delivery, 2,500 per delivery. And since the onset of SHA, we claimed 10,000 per delivery, which is able to sustain our needs.
But the biggest test lies in whether drugs are available when patients need them. Stockouts have become a familiar frustration for health seekers in hospitals across the country, with KEMSA being blamed for inefficiency. The Health Cabinet Secretary Aidan Duale, however, says the government is working to ensure KEMSA is fixed.
Today, the fill rate of KEMSA, as we speak this morning, is going to about 60%. We have now secured another 10 billion credit line with Kenya Commercial Bank. And we must make sure that they take it to 95% by November.
Critics have called the SHA financing model unsustainable. There's also concerns about the benefit limits under SHA, with media reports documenting tens of patients whose covers have run out and they are forced to pay out of pocket for the remainder of the financial year.
Kenyans will go for twice a week for dialysis, have no problem because they will be paid by SHA. But those who go for 3, then the 3rd session, they have to pay. But when your cover is exhausted, then automatically you will now go to this other fund.
Mary Mwoki, Citizen TV.